Folks, thanks for coming on the line with us today. My name's John Dubas. I'm a Vice President for Agent Success with Premier Marketing. We'll be spending the next hour or so discussing Medicare in the Marketplace, a topic of great interest at this particular point in time, simply because we are in an open enrollment period for both the Medicare population and for folks who are looking at individual health insurance policies for themselves and for their family. So what we will do is give you a bit of information, not only about our organization, a very short synopsis of that, and some of the things that we can do to help you with this market. But keep in mind, today's presentation is being recorded, and the presentation and the information on the Medicare Marketplace scenario in both English and Spanish will be sent to those who have expressed interest in today's program. A bit about Premier Marketing. We are a national marketing organization founded in 1968. That's part of the Integrity Marketing Platform. We have offices across the country providing insurance services to independent agents with contracts at the highest possible commission levels, with recruiting contracts available to those who qualify. As I mentioned, we were founded in 1968, so this is our 50th anniversary. We're very proud of that accomplishment and have enjoyed a great relationship with agents throughout the years and look for that to continue in the future. We are one of the largest organizations in the Medicare space, being the largest producer with United Healthcare for their Medicare Advantage products, Anthem's Medicare Advantage products, Meridian Care in their Advantage products, along with being one of the highest producers for many of the other Medicare Advantage and Medicare supplement companies. This gives you an idea of the scope of our organization and our affiliated platform. And our insurance portfolio includes products in addition to the Medicare products, including life insurance and annuity programs, final expense life insurance with pre-need programs, long-term care, short-term care, disability income, and ancillary products that folks of all ages are looking at and are a great additional sale for an independent agent. That Medicare Advantage portfolio includes all of the brand carriers that you think of, the national players, along with many of the regional carriers that are of great influence in certain markets. That also applies to our standalone prescription drug portfolio and our Medicare supplement portfolio. As we go into 2019, we've just experienced this week a great opportunity for you to voice your opinion about the regulations and the electorate, or the folks that take care of us within the political system, supposedly. And that brings about different changes in our world as well. One of the things that we're seeing that is different going into 2019 is the MADP period going back to the future of the Medicare Advantage open enrollment period, where the first 3 months of the year will give Medicare beneficiaries an opportunity to switch to a different Medicare Advantage plan if they're already on one, drop a Medicare Advantage plan and return to original Medicare, enroll in a standalone Part D program at that particular point in time if they're returning to original Medicare and have drug coverage, or they can drop that drug coverage should they see that as their best option. One additional thing that we're seeing as well, and that's influencing different parts of the country, is the fact that Medicare cost plans are sunsetting in most areas. They're being discontinued in service areas where at least 2 competing Medicare Advantage plans meeting enrollment thresholds are available. And this has been prepped since 2015 in the passage of the MACRA legislation. So it's not like it's a great dawning of something new, but it's been coming. We also are going to see some changes in 2020 in a year based on certain types of Medicare supplement programs that can be offered in the future. One of the things that we do here at Premier is reference our partners within the government. Believe it or not, there is a partnership within the government, and that includes accessing information regarding training resources from CMS's National Training Program. And the presentation we'll go through today addressing Medicare in the Marketplace is pulled from this source. It is an invaluable resource for us who are active in the Medicare space. I would strongly recommend that you go to this website, register, and keep yourself up to date with different training programs that are available to the public through this resource. The presentation itself that we're going to speak to is Medicare and the Marketplace, and it gives us an idea as to what people with a Marketplace plan needs to know when they're becoming eligible for Medicare. It is available in English and Spanish. However, since John Dubas doesn't speak Spanish, today's presentation is coming to you in my modeled form of English. So it's coming to you this way now. This is a training that was developed and approved by the Centers for Medicare and Medicaid Services, which is CMS, and that's the agency that actually administers Medicare or Medicaid, CHIP, the Children's Health Insurance Program, and the federally facilitated health insurance marketplace. You can check for updates at the HHS.gov website, and this, even though it's dated July of 2017, is current. The things that we'll discuss today are Medicare eligibility and enrollment opportunities, the enrollment decisions that are faced by people in this situation, the considerations a person in this situation has to take into account. We also will address Medicare and the eligibility for advanced premium tax credits and the periodic data matching program, and give you some helpful resources to understand this program. In this section, we'll talk about Medicare eligibility and enrollment and how it affects the decisions a person has to make when it comes to the coverage and cost that they have as part of their overall program. One of the things that we find for many folks is they don't realize that Medicare Parts A and B may be automatic or they may not be. If someone's already receiving Social Security benefits, they're automatically enrolled in Medicare Part A, which is the hospital coverage, and Part B without additional applications. These folks actually receive their initial enrollment package, which includes their Medicare card and other information, about 3 months before they turn 65, and that coverage begins the first day of the month a person turns 65, or 3 months before the 25th month of disability benefits, and that coverage begins on the 25th month if someone is under 65 and has applied for and is bound to be receiving coverage through Medicare because of their disability. If a person isn't receiving retirement benefits from Social Security or the Railroad Retirement Board, you need to sign up to get Medicare. And we'll talk about the periods when you can enroll a little bit later. The full retirement age, which is normally called, which is also called the normal retirement age, has been 65 for many years. However, we're coming into a time period where folks who were born in 1938 or later, where that age gradually increases until it reaches the age of 67 for folks born after 1959. Since Medicare age is still 65, but if people are waiting to sign up for retirement benefits after 65, they might have to take action to get Medicare because it's not automatic. The government does offer different tools to help you calculate your Social Security retirement and some other information through the Social Security website, ssa.gov. If you are one of those folks that find that you're not automatically enrolled, you need to enroll with Social Security. You can do it online at socialsecurity.gov. You can call their toll-free number, 1-800-772-1213, or you can visit the local office or call for voice assistance through another number as well. If you retired from the railroad, you need to enroll through the Railroad Retirement Board through the local office or 1-877-772-5772. So keep in mind, you don't have to be retired to get Medicare. When do you need to enroll in Medicare? Well, your first and most important chance to enroll in Medicare, especially Part B, is during your initial enrollment period, called an IEP. This IEP lasts 7 months. It begins 3 months before a person turns 65 and ends 3 months after the person turns 65. The Part B or the Premium Part A coverage will start based on when you enroll. If you enroll during the first 3 months of your IEP, your Part B coverage will begin the first of the month you turn 65. If you enroll in the month you turn 65, your coverage will begin the first of the next month. If you enroll in the last 3 months of your IEP, and those are the 3 months after you turn 65, your coverage will begin 2 to 3 months after you turn 65. These delays are required by law. If you don't enroll in Part B or Premium Part A during your IEP, you may have to pay a lifetime penalty thereafter. If you're eligible for premium-free Part A, where you or your spouse paid enough Medicare taxes in order to receive that benefit, you can enroll in Part A during your IEP and any month thereafter. If you're not eligible for free Part A because you or your spouse didn't pay Medicare taxes, you have to pay a premium for that Part A coverage, and you can only enroll in Part A during your IEP or during limited Part B enrollment periods. Only people who don't qualify for premium-free Part A must pay a premium for Part A coverage. The rest is covered because of the payments into Medicare taxes. You must pay a monthly premium for both Part B and Premium Part A coverage if you don't qualify otherwise. If you're eligible for the free Part A, you can enroll only in Part A during the IEP, or you can enroll in any month after your IEP month and the 2 months after your IEP ends, and it becomes effective the first of the next month. And if you didn't sign up for your Part B or the Premium Part A during your IEP, you can enroll during the General Election Period, which is a GEP. We like using a lot of acronyms here. For the most people who don't enroll during their IEP, this is their only chance to enroll in Part B. That General Election Period occurs each year. It begins January 1st and ends March 31st. If you enroll in the GEP, your coverage will start on July 1st. This is another requirement mandated by law. If you weren't eligible for premium-free Part A and you don't buy it when you're first eligible, your monthly premium may go up 10%. You'll have to pay the higher premium for twice the number of years you could have had Part A but didn't sign up. In addition, if more than 12 months have passed since you turned 65, you'll likely have to pay a lifetime penalty that's added to your monthly Part B premium as well. This means that your monthly premium will be higher than if you signed up during your IEP. The longer you go without coverage, the higher the penalty. There are very few special election periods for Part B and Medicare Part A enrollment allowed by law. Most people won't qualify for an SEP. However, if you're still working, you may be eligible. An SEP allows you to enroll after your IEP and not wait for the GEP. And you don't have to pay a penalty. If you didn't sign up for Part B or the Premium Part A during your IEP, you may be able to enroll during this time period. It is a limited special election period. To be eligible, you must have employer group health insurance based on active current employment. If you're 65 or older, you must get this employer-sponsored coverage based on your or your spouse's current employment. If you have Medicare based on disability, well, you can also have that employer-sponsored coverage based on a member's current employment. People who have Medicare based on end-stage renal disease don't qualify for an SEP. To qualify for that SEP, you must have the group coverage for all the months you were eligible to enroll in Part B but didn't. For most people, this means you had group health insurance coverage since you turned 65. You can enroll using that SEP at any time while you have the group coverage based on that active current employment. If you lose either the group coverage or your current employment, you have 8 months to enroll. If you don't enroll within those 8 months, you'll have to wait until the next general election period to enroll. You'll have a gap in your coverage, and you may have to pay a penalty. Marketplace consumers can choose to delay Medicare and stay enrolled in the marketplace, but terminating marketplace coverage doesn't provide an SEP to enroll in Medicare. We'll discuss later different considerations to take into account these different enrollment periods and the possible late enrollment penalties. It's also important to note that COBRA, retiree coverage, long-term care, workers' compensation, or VA coverage isn't considered active current employment. When we look at the Medicare enrollment decisions, these are decisions that one needs to make as you become eligible for Medicare. We need to consider different things that come into play when you look at signing up for Medicare Part A. Remember, if you're receiving Social Security or retirement benefits from the railroad at least 4 months before you turn 65, you're automatically enrolled. If you don't get Part A automatically, you need to consider signing up for Part A when you're first eligible during IEP. Most people don't pay a monthly premium for Part A coverage if you or your spouse have paid Medicare taxes while working. If you aren't eligible for the free Part A and you don't buy it when you're first eligible, your premiums go up 10% for every 12 months you don't have the coverage. You'll have to pay the higher premium for twice the number of years you could have had Part A but didn't sign up. The 10% surcharge will apply only after 12 months have elapsed from the last day of IEP to the last date of the enrollment period you used to enroll. In other words, if it's less than 12 months, the penalty doesn't apply. The penalty won't apply to you if you're eligible for an SEP. Remember, you're only eligible for an SEP if you or your spouse or family member, if you're disabled, is actively working and covered by a group health plan through the employer or union based on that work, or during an 8-month period that begins the month after the employment ends or the group coverage ends, whichever happens first. If you're still working or you have coverage through a spouse, you need to talk to your employer benefits administrator to learn how enrolling in Medicare or delaying that enrollment will affect your employer coverage as well. You shouldn't contribute to an HSA, a health savings account, if you have Medicare. You need to talk to your company's benefit administrator about stopping that contribution to an HSA if you plan to sign up for Medicare. And you might have to stop contributing to your HSA up to 6 months before your Medicare starts. You can withdraw money from your HSA after you enroll in Medicare to help pay for medical expenses like deductibles, premiums, co-payments. If you contribute to your HSA after you have Medicare, you could be subject to a tax penalty by the IRS. It's important to note that if you have a marketplace plan and you sign up for Medicare, you lose any tax credit and reduced co-payments and co-insurance you might have been getting. Times you need to have Part B, well, you got to have it if you want to buy a Medicare supplement insurance policy, a Medigap policy. You need to have it if you want to join a Medicare Advantage plan. And if you're eligible for TRICARE for Life, this coverage actually provides expanded medical coverage to Medicare eligible uniformed services retirees 65 or older, to their eligible family members and survivors, and to certain former spouses. You must have Medicare Part A and Part B to get TRICARE for Life benefits. However, if you're an active duty service member or the child or dependent child or spouse of an active duty service member, you don't have to enroll to Part B to keep your TRICARE coverage. When the active duty service member actually retires, you got to enroll in the Part B to keep your TRICARE for Life coverage. You can get Part B during a special enrollment period if you have Medicare because you're 65 or older or disabled, and that information is on the tricare.mil/mybenefit website. You also have to keep in mind that your employer coverage requires you or your spouse family member to have it if there's less than 20 employees in your company. You need to talk to your employer or the union benefits administrator to make certain that you stay in line there. If you're eligible for civilian health and medical program offered by the Department of Veteran Affairs, CHAMP VA, you must have Part A and Part B to keep that coverage as well. Keep in mind, Veterans Affairs benefits, the VA benefits are separate from Medicare. With VA benefits, you may choose to not enroll in Part B, but you might have a penalty if you don't sign for Part B when you're first eligible during that IEP. So if you have VA coverage, you won't be eligible to enroll in Part B using a special election period either. We got to make certain that we follow all the rules that are dictated for us. When we look at Part B and active employment, you don't have to take it when you're first eligible, Part B that is, but you'll have to pay a premium penalty of 10% for each full 12-month period you could have had Part B but didn't sign up for it unless you have special circumstances. In most cases, you'll have to pay that penalty as long as you have Part B, which generally is the rest of your life. If you don't take Part B when you're first eligible, you might have to wait until that general election period to pick it up, which once again, that runs from January 1st to March 31st of every year, and the coverage is effective on July 1st of that year. If you have coverage through an employer or a union while you or your spouse or a family member, if you're disabled or still working, that can affect your Part B enrollment rights. If you or your spouse are covered during active enrollment, you do have that special election period once again. That means you can join Part B anytime that you or your spouse or family member are covered by the health plan or during that 8-month period, which begins after the employment ends or the group health coverage ends, whichever happens first. In today's world, we're seeing companies drop health coverage, so it's an important consideration you watch that. Again, you don't pay a late enrollment fee if you sign up during an SEP, and again, that SEP doesn't apply to folks who have end-stage renal disease. When you look at the considerations between Medicare and the Marketplace, well, this is going to tell us if you should keep the Medicare Marketplace, or pardon me, you should keep the Marketplace coverage, drop it, or enroll in Medicare. From different considerations, well, we'll focus on the individual Marketplace and what folks who either have Medicare or soon be eligible for Medicare need to know to make an informed choice. This is important to help ensure that we're aware of the decisions and how they affect coverage and possible penalties. The health insurance marketplace is designed to help a person find and buy health insurance that fits their budget. Chuckle. But it generally isn't a place for someone with Medicare to look for better health coverage. We'll explain when people have Medicare who might be involved in the marketplace and when they cannot do so. We'll talk about someone who needs to know about the marketplace and how it relates to their prescription drug plan under Medicare as well. There is a marketplace for small employers. It's called the Small Business Health Options Program, or SHOP. You see communications come out from Medicare about this if you are signed up for updates from CMS. We'll talk briefly about that program later, and we'll also cover some information to help pay Medicare costs for people who have limited income and resources. Keep in mind, Medicare is not part of the marketplace. If you have Medicare Part A, you have minimum essential coverage, a MEC, which means you won't be subject to the individual shared responsibility payment, sometimes called the penalty or fee, for not having that coverage. If you only have Medicare Part B, you don't have MEC. If the marketplace doesn't change your Medicare plan choices or your benefits, no matter how you get Medicare, whether it's through original Medicare, Parts A and B, or you're enrolled in a Medicare Advantage plan like a HMO or a PPO, you don't have to make any changes. The marketplace doesn't offer Medicare supplement insurance, Medigap policies, or Medicare Part D plans. Now, if you do have Medicare, it's against the law for someone who knows you have Medicare to sell you a marketplace plan. This is true even if you only have Part A or only Part B. The exception is a marketplace plan through your employer through SHOP if you're an active worker or dependent of an active worker. SHOP coverage might pay first before Medicare. If you delay enrollment because you have SHOP, you won't have a late enrollment penalty as long as you follow the same guidelines for having health coverage, active health coverage through work, or within that 8-month period after losing that coverage. Keep in mind, it doesn't include COBRA. If you have a marketplace plan and you're eligible for Medicare, you'll no longer be eligible for help with your marketplace costs like premium tax credits or cost sharing reductions. Most individuals who are eligible for free Medicare Part A will want to terminate their marketplace plan and enroll in Medicare. Keep in mind, if you choose to drop your marketplace plan, take the action as soon as possible. If you're ending coverage for everyone on the application, your termination can take effect as soon as 14 days from the day that you cancel. Your health insurance company will collect premiums during that final 2-week period. You can set the marketplace coverage end date to a day more than 14 days in the future, like if you know if your new coverage is going to start the first of the following month, and that's more than 2 weeks away. If you're ending coverage for just some of the people on the application, in most cases, their coverage will end immediately. Once you're eligible for Medicare, remember, you have that initial enrollment period to sign up. In most cases, it's to your advantage to sign up when you're first eligible, because once you're getting Medicare, you won't be able to get the lower cost for a marketplace plan based on your income, like premium tax credits or reduced cost sharing, except if you only have Part B. If you have limited income and resources, you might be eligible for help paying Medicare Part B and Part D premiums, and for some reduced cost sharing for Medicare Part D coinsurance and copayments. We'll talk about this in a little bit. You can choose marketplace coverage instead of Medicare under certain conditions. If you're paying a premium for Part A, you can drop your Part A and Part B coverage and take a marketplace plan instead. If you only have Part B and have to pay a premium for Part A, you can drop Part B and get a marketplace plan instead. And if you're eligible for Medicare but haven't enrolled because you'd have to pay a premium for Part A, or you have a Medicare a medical condition that qualifies you for Medicare, like end-stage renal disease, and haven't applied for Medicare coverage yet, or if you're not collecting Social Security, retirement, or disability benefits before you're eligible for Medicare, or if you're in your 24-month disability waiting period. Keep in mind, before choosing a marketplace plan over Medicare, there are 2 important points to consider. If you enroll in Medicare after your IEP ends, you may have to pay a late enrollment penalty for as long as you have Medicare. And generally, you can only enroll in Medicare during the Medicare General Enrollment Period. Remember, that's January 1st to March 31st, and that coverage doesn't start until July 1st of that year. If you don't have, or if you dropped Medicare Part A because you have to pay a premium and you enroll in a marketplace plan, you'd be eligible for the tax credit and the cost sharing reductions, assuming that you meet those eligibility requirements. If you are enrolled in Medicare, you could opt to terminate it and enroll in a marketplace plan. However, your eligibility for a premium tax credit could be affected. For instance, if you're enrolled in Parts A and Part B, or premium Part A and Part B, or Part B only, you can disenroll from Medicare and enroll in the marketplace plan. In this case, you could qualify for the advanced payments of the premium tax credit or cost sharing reductions if you meet the eligibility requirements. However, if you're enrolled in Medicare Premium Free Part A, you must withdraw your application for Social Security benefits, pay back all Social Security and Medicare benefits received before you could terminate Medicare. In such cases, you'd lose your eligibility for those tax credits or cost sharing reductions. Let's go a different way. If you're enrolled in a marketplace plan and you become eligible for Medicare, you can choose to remain enrolled in the marketplace. However, there are important considerations such as once your Medicare Part A starts, you're no longer eligible for the advanced payments of the premium tax credit or those cost sharing reductions. If you plan to keep both your marketplace plan and Medicare, you need to update your marketplace application to reflect Medicare coverage so the marketplace eligibility can be redetermined. Medicare doesn't coordinate benefits with Marketplace, and your Marketplace plan won't pay like a Medicare supplement. Depending on your Marketplace plan benefits, they can pay for some services after Medicare pays. If you decide to terminate your marketplace plan when you enroll in Medicare, it's important to time that termination appropriately. If you choose to drop your marketplace plan, take the action as soon as possible. You can set the marketplace coverage end date to a day more than 14 days in the future. Like if you know if your new coverage is going to start the first day of the following month, and that's more than 2 weeks away. There are call centers. The marketplace does have a call center to help you with that determination. So let's look at some scenarios of Medicare and eligibility for advanced premium tax credits. Bernie has more than weekends to look at the tax credits, and let's look at him when he's eligible for a premium-free Medicare Part A. He turned 65 on June 3rd. He currently has a marketplace plan with the tax credits. His IEP has begun, and he enrolls during the last month of his IEP. When we look at this, then, Bernie signed up for that during this last month. He'd no longer be eligible for his tax credits on October 1st, which is the first day of the first full month after his IEP ends. Because he qualifies for premium-free Medicare Part A, his Medicare coverage would be retroactive to the first day of the month that he turned 65. This means that his coverage would be retroactive to start on June 1st as well. We have another situation here with Sally that we're going to go through, just breeze through in consideration of time. We'll do the same thing with Hannah. Keep in mind you are going to be receiving this presentation with annotated notes as well. This slide gives you a nice representation of that time period based on when an individual signs up for Medicare and when that coverage becomes effective. It's important to note that we've got some key points for Medicare Premium Free and Premium Part A folks. We need to encourage consumers to consider all their options when deciding to enroll or not to enroll in Medicare Part A. Consumers may be responsible for paying back any advanced premium tax credits received during the time when they were receiving benefits from Medicare. So this could be a huge financial consideration. The consumers who are eligible for premium-free Medicare Part A and don't enroll in Medicare are no longer eligible for those tax credits the month after their IEP ends. And consumers who are eligible for premium-free Medicare Part A should enroll as soon as possible. If consumers are enrolled in premium-free Part A, they need to return to the marketplace to end their tax credits and will have to pay full price for the premiums for the marketplace plan. If consumers don't enroll in the premium Medicare Part A during their initial enrollment period, they might have to pay late enrollment penalties when they do decide to enroll. This may include a gap in coverage if they have to wait for the general election period. The Medicare periodic data matching that we referenced earlier in today's presentation, this explains the process through which the eligibility of a person for Medicare is checked against the data available for those who enrolled in the marketplace coverage. The marketplace is mailing paper. It won't post electronic to an account this data, and it gives notices to the household contact for consumers who might be duly enrolled in minimal essential coverage, MEC, which is Medicare Part A, remember Part B is not, and a marketplace plan. If there is a consumer of any age who's been determined eligible for or is enrolled in a Medicare, he or she is generally not eligible to receive financial help to pay for a marketplace premium plan or for covered services. So consumers need to be aware and encouraged to follow the instructions that are sent to them on their Medicare PDM notice. It's important to note also that consumers who've received a PDM notice don't have Part B. They may have a special opportunity to sign up for Part B, and they must visit their Social Security office to exercise that option. The folks who have received a periodic data matching notice might be eligible to request the late enrollment penalty be reduced or removed even. They must be currently or previously duly enrolled in Marketplace coverage with or without the tax credits and Medicare Parts A and Part B. They've got to visit their Social Security office to request the removal of this penalty. When you look at folks who are in Medicare because of disabilities, and you look at the situation they have, if they're entitled to Social Security disability insurance, they might qualify for Medicare that way. And there is that 24-month waiting period before Medicare coverage can start. So that waiting period generally begins when a person first starts receiving those Social Security disability insurance benefits, which don't start until you've been disabled for 5 months. During this waiting period, they can apply for coverage in the Marketplace. The Marketplace application process will determine if they're qualifying for Medicaid or for premium tax credits that lower the monthly plan premium and the cost sharing reductions that lower out-of-pocket costs. The Medicare coverage is effective generally for these folks at the 25th month of receiving this disability insurance. Medicare cards mailed about 3 months prior to that 25th month of disability. And if a person doesn't want that Part B, they've got to follow the instructions that are included with the card. However, once a person's eligible for Medicare, you won't be able to get lower cost on a Marketplace plan based on income. So those credits are gone. Also, once the Part A starts, you're no longer eligible for any premium tax credits or reduced cost sharing they might have qualified for under the Marketplace. And that's because Medicare Part A is considered minimum essential coverage, but not Part B. Some additional things to keep in mind: if the individual has coverage through SHOP based on their or their spouse's current employment, this coverage from an employer through SHOP is treated the same as coverage through an employer group health plan. If they're getting health coverage from an employer through SHOP based on current employment, Medicare's secondary payer rules apply. So you could delay enrollment in Medicare Part B if you're getting health coverage from an employer through SHOP based on current or spouse's current employment. And you'd have a special election period to sign up for Part B without penalty, just like with group coverage. So anytime you're covered by a group health plan based on your or your employer's current coverage, you qualify for that SEP, and you have an 8-month period that begins after the month of current employment ends or the coverage ends, whichever happens first. If you don't sign up during that SEP, you may have to pay a Part B late enrollment penalty for as long as you have Medicare. And you can only enroll during the general election period, which occurs each year, once again, January through March, with the coverage beginning the 1st of July. Now let's talk about drugs. While prescription drug coverage is an essential health benefit, prescription drug coverage in a Marketplace or a SHOP plan isn't required to be as good as Medicare Part D coverage or be, in essence, creditable. However, all private insurance companies offering Medicare drug coverage, including Marketplace and SHOP plans, are required to determine if that prescription drug coverage is creditable each year and let you know in writing. You might have to pay a late enrollment period or late enrollment penalty for Medicare Part D if you enroll after your IEP and you didn't have creditable drug coverage from the time you were first eligible for Medicare. The rules for Marketplace plans to provide that information to you are the same as all private insurance carriers who are offering drug coverage to Medicare eligible individuals. If you don't enroll in Part D during that initial enrollment period, that IEP, you might have to pay a late enrollment penalty for as long as you have Part D coverage as well. So if you want to find out which prescriptions are covered under the Marketplace plan, you can visit your insurer's website. You can review your summary of benefits and coverage, which is available on healthcare.gov/see plans. You can call your insurer to find out what's covered and have your plan information available, and they can tell you. and then you can review any coverages that might have been mailed to you in order to get that information you need. Keep in mind, in most cases, you may not be able to purchase a standalone dental plan through the marketplace. If the marketplace in your state is run by the federal government, you won't be able to buy a standalone dental plan. If your state is running its own marketplace, you might be able to buy a standalone dental plan if one's available. You need to check with the state. Keep in mind, dental coverage is not covered by original Medicare. It may be covered by some Medicare Advantage plans. So for some folks who are transitioning from the marketplace to Medicare, coverage might be of a concern because they lost their tax credits to help with the premium cost, and they lose them when they qualify for Medicare. However, they might qualify for some other things to help pay for Medicare cost. States have other programs that pay Medicare premiums, and in some cases, may also pay Medicare deductibles and co-insurances for people with limited income and resources. We have a separate training program specifically on these coverages. These programs frequently have higher income and resource guidelines than full Medicaid. So they are collectively called Medicare Savings Plans and include Qualified Medicare Beneficiary Status, QMB, QMBs, Specified Low Income Medicare Beneficiary Plans, SLIMBs, Qualifying Individual Q1, or Qualified Disabled and Working Individual QDWI. You need to contact the State Health Insurance Assistance Program, SHIP program, to find out which programs are available in which area and to whom, or a qualified insurance agent who can help with that as well. These are updated each and every year. Additionally, if you have a person with limited income and resources, you might get extra help paying for the prescription drug costs. These are based on federal poverty level guidelines, which are generally updated, they are updated annually and available in late January, and they determine the income level requirements for the folks who are qualifying for this extra help. If you have the lowest income and resources, you won't pay a premium or a deductible and have small or no co-payments on the drug plan. If you have slightly higher income and resources, you'll have a reduced deductible and pay a little more out of pocket. This goes up to 150% of that federal poverty level. So if you qualify for that extra help, you don't have a coverage gap, the donut hole, or a late enrollment period, or a late enrollment penalty, I should say, and you have a special election period to switch plans. This used to be each and every month. This is now changed to a quarterly SEP. The information is available on the Social Security website. It's really easy to apply online as well for this assistance. Keep in mind, you can qualify automatically for extra help, and the person doesn't need to apply if they have Medicare and get full Medicaid coverage, supplemental security income, SSI benefits, or help from Medicaid paying their Part B premiums through a Medicare savings plan. That LIS comes automatically. If a person doesn't meet one of those conditions, they can still qualify for drug help through the extra help, but they need to apply for it. Even if you're not certain if the person qualifies or not, it's important to help them apply. And you can apply at any time, and if you're denied, you're going to reapply if your circumstances changes as well. Eligibility for this extra help is determined either by Social Security or the State Medical Assistance Medicaid office. Once again, you can get that help online at socialsecurity.gov. You can call Social Security at their toll-free number and ask for the application, or you can contact the state Medicaid agency as well. It's important to note that if you think you might qualify for any of the programs that come into play, you need to review the income and assets to make certain that it comes as that you meet those guidelines, and you need to collect your personal documents to make certain that you have everything you need for the application process. This includes Medicare card, proof of identity, proof of residence, proof of income, including pension checks, Social Security payments, etc., recent bank statements, property deeds, insurance policies, financial statements for stocks and bonds, proof of funeral or burial policies as well. You don't necessarily submit that with the application, but it's important to have it so you can properly complete the application. And you can get that help through the agencies that we've referenced already. Completing the application is part of the process that you do with the state medical assistance program, the Medicaid office, or Social Security. This is a scenario for an individual that we'll just go through. And let's talk about some of the resources that are available for you to stay up on all of the requirements for these programs. One of the things that we have in our modern world is constant communication, and you can sign up for updates through different organizations, or you can reference them online. Keep in mind this material is going to come to you, so you have a point of reference to reach out and get the information you need to help folks with their decisions as to whether they should stay in one program or another. Tons of references that are going to come to you. So keep in mind this presentation is available through CMS's National Training Program. It is available currently in English and Spanish. It will come to you as follow-up to today's presentation as well. And you should be receiving that follow-up as soon as the recording to today's presentation updates so we can get it to you. Some of the things that you have as resources from Premier to help you help people through these decisions that they have to make of staying in one program or going to the other is keeping in mind that we can help you with discounted E&O for agents affiliated with our organization, and it covers any insurance program that you offer with any upline. It's very reasonably priced and puts you in a true independent agent status because it applies to carriers you have across the board. We also help you keep your license up to date with discounted continuing education credits. We can help you become contracted with multiple organizations fairly easily through an electronic means of contracting through SurancePay. You set up an agent profile and you can electronically fill contract information. It's our way of helping with the carpal tunnel syndrome. We do offer additional training programs that help you market programs to both folks that may be affected by Marketplace or Medicare programs. Our strength is in the Medicare world. We have the knowledge there to help you not only with the programs themselves, but give you means to reach out to people and get in front of them so they know that you are available to help them with their needs in the circumstance. We do provide different means of electronic enrollment and quote engines that are incredibly helpful to you during the times that we're in right now when you have limited days in the calendar to get in front of folks and help them with their coverages. We do also have a program that can help you put your social media outreach on autopilot. That's Coverage Made Easy. We've got additional details for that for you too, and different lead programs that can help you reach out to the general public. The information like today's presentation can be very helpful to you in community presentations, either electronically, as much as what we're doing here today, or live and in person in a seminar selling circumstance. So we do offer mail support based on production, and we want to be your partner in offering these programs to the public. What you have to do is decide what fits in your personal marketing plan, engage in the process of being able to offer those programs, and rely on the support that we can deliver for you to help people in the community. This is the contact information for Premier Marketing. Dials into our home office, 1-800-365-8208. The three folks on the screen or here in our Texas office. But dialing into that 800 number will get you in touch with the Medicare or individual health marketer that you're currently dealing with our organization. If you don't have someone that you're working with, please let us know and we'll help you with however your situation dictates. We went through a lot of information very quickly. When we check on the questions that come through today's presentation through the system, once again, I'm going to repeat that today's information is being recorded, and you will get both of the presentations in a PDF as follow-up to today's presentation. So watch for that information. We'll get you that along with some additional data that can help you be effective in marketing these programs. That said, I want to thank you for coming on the line with us today, spending your most precious resource with us, which is your time. Watch for the information. We look forward to speaking with you in the very near future, and we wish you good selling. Thanks so much. Talk to you soon.